Modern cataract surgery is perceived as refractive surgery and expectations are high. These days, patients undergoing cataract surgery live more active lifestyles, spending large amount of time both outdoors and in front of computer and smartphones. For many, good uncorrected distance vision is not enough anymore, and complete independence from spectacle is the goal. Well, this expectation of perfect vision post-cataract surgery is now a reality with the help of premium IOLs. Premium intraocular lenses, as the name says, not only treat cataract but also addresses other forms of vision impairment, including presbyopia. Hello friends, this is Dr. Shweta Jain from iMantra Hospital, and in this video I am going to guide you all about choosing the lens which will suit your personality, your routine and your expectations. In this video I am going to discuss what is premium IOLs, how do they differ from the standard IOLs, different kinds of premium IOLs, what to expect from premium IOLs, and lastly, contraindications to use premium IOLs. So let's start by understanding what is IOL or intraocular lens. During any lens-based refractive surgery, whether it is the cataract surgery or the refractive lens exchange, the natural lens of the eye will need to be replaced with an artificial intraocular lens. The intraocular lens or IOL takes over the role of natural lens, which is to bend light rays that enters the eye so that they can be focused to create a clear image on the retina. A standard IOL is the one that is monofocal, meaning that it improves vision at only one distance. While a standard IOL does treat cataract and improve patients' distance vision, most patients will need to rely on glasses to improve near and intermediate vision and sometimes even for distant vision. Premium IOLs. A premium IOLs, on the other hand, have several advantages. They correct both distance and near vision. They provide a better range of vision after cataract surgery. Premium IOLs have an aspheric shape and match more closely to the optical quality of the human's natural lens and thus provide better vision quality. The aspheric lens corrects the spherical aberration or scattering of light from the lens. The shape of premium IOL provides better lens stability and prevents PCO or post-cataract complications. Also, hydrophobic property of lens is preferred over hydrophilic properties owing to their better optical properties and lowering the formation of PCO. They can offer various other additional features and properties which are beneficial for your eyes, for example, anti-glare, extended focusing, HD vision, anti-PCO ring, blue light filter, etc. So summing up, premium IOL implies aspheric hydrophobic IOL with different optical characteristics because these lenses can treat cataract while also improving distance, intermediate and near vision. Most patients don't need to rely on glasses after being treated with a premium IOL. Moving on to the most important part of this video, here are the different types of premium IOLs. Bifocals, or commonly termed multifocal IOL. In case of a traditional monofocal IOL, many patients are not satisfied as only distance vision is rectified, not near vision. Multifocal IOLs provide spectacle independence at both near and distance. Some patients might require small power for intermediate vision, especially those who work on computer for long hours. Multifocal IOLs can be further classified as refractive and diffractive IOL. Examples of multifocal or bifocal IOL include IDIF from Care Group or Zeiss bifocal. The cost of the surgery package with bifocal IOL stands at 45,000, whereas the Indian counterpart costs only 35,000. But as every good things have some drawbacks too, these lenses have some negative effects as well. Let's understand these. How do these lenses work? They have multiple concentric rings, around 50 to 70 of them. Something like this. Half of the ring focuses for near and the other half focuses for distance. So when the light rays are incident on the lens, 80% are reflected into the eye, which focuses on retina, but nearly 20% falls on these ring junctions and thus scatter away, leading to the problem of halos and glare. Only 1 out of 15 with multifocal implant faces these issues, and often the brain adapts to it within few months. Another small problem with multifocals is the loss of good contrast. Since less than half of the IOL is being used to see either distance or near at any particular time, There is minimal loss of contrast felt by a very few implanted with multifocal IOL. Next, let me talk about the advanced and the much better version of the multifocals. Trifocal IOL. Trifocal lenses help correct not only distance and near but intermediate vision as well. So this is the perfect choice for computer users, home cooks or chefs who indulge in intermediate vision a lot of time in a day. Some modern trifocal IOL models combine both optical properties, refractive and diffractive, but provide you with clear vision at all distance including distance, intermediate and near. For instance, the AT Lisa from Carl Zeiss Germany is available in 3 designs and consists of refractive-diffractive optic surface profile with a 3.75 diopter near addition. These lenses provide clear vision at all distances including distance, intermediate and near, with minimal complaints of halos, glares and reduced contrast. The newest trifocal PanOptix from Alcon also employs a diffractive design but improves on it to provide much better intermediate vision as well. Package surgical cost of these imported trifocal IOL implant ranges between 75,000 to 90,000. Promising and comparable results are also achieved by Indian trifocal such as Tridif from Care Group. Also, the Indian category of lenses reduces the cost drastically to even half of their imported counterparts. So both multifocals and trifocals are the new normal, which are being put left and right in all kinds of patient, young or old, highly active people or retired. These lenses provide you independence from the spectacle with tolerable amount of glare, halos and reduced contrast sensitivity. But what does a patient do if he's a frequent driver at night or he has a job requiring high precision and focus from their eyes? The little glare, halos and loss of contrast can cost high on their jobs and can make their life difficult. So that leads us to the next and the latest category of IOLs, extended depth of focus IOLs called EDOF lenses. EDOF IOLs such as Tecnis Symphony from Johnson & Johnson and the newest one in this section, Swiss Lucidis, combine a unique diffractive pattern with technology that corrects corneal chromatic aberration, the disorder in vision which occurs due to dispersion of light rays into various colorful components. This enhanced vision quality and the lack of aberration provides extended depth of focus, which enables the patient to see clearly at all distances from distance to intermediate with no loss of contrast and no halos and glare. The quality of vision with these lenses are excellent, with only a small cost of wearing a minor part for doing fine work at near. Near visual acuity with EDOF lenses may be worse than with multifocal IOLs, but intermediate visual acuity is equal or much superior. Swiss Lucidis provides clear distance, intermediate vision and near vision like trifocal lenses with minimum side effects as compared to multifocals. But trifocals obviously offer better near vision. So if you cannot compromise on your near vision but can bear with the minor side effects like glares and halo, then trifocals are the IOLs for you. But if you want a perfect quality of vision and don't have a lot of near work to do, or you don't mind wearing a small pair of specs for fine work, then EDOFs are perfect choice for you. The cost of surgery with EDOF lenses ranges from 60,000 to 70,000. Whereas similarly, their Indian counterparts come at a much cheaper rate. Lastly, let's discuss about the toric IOLs. Toric IOLs offer the patient the opportunity to correct the corneal astigmatism at the time of cataract surgery and achieve spectacle independence for distance vision. The Acrisoft toric IOL and Zeiss toric IOL are the hydrophobic acrylic lens and contain a blue light filter. They provide excellent distance vision in patients with astigmatism greater than 1 diopter. The cost of surgery with these lenses range from 40,000 to 50,000, whereas their Indian counterparts are priced at 35,000 to 45,000. Toric multifocal IOLs. Multifocal toric IOLs offer the opportunity for spectacle independence for distance, intermediate and near vision, regardless of the corneal astigmatism. However, in patients with toric multifocal IOLs, surgeons have to face even more potential error sources, including rotation of IOL and the correct estimation of corneal astigmatism. Therefore, a thorough assessment of patient before surgery is even more crucial for excellent refractive outcome. Cost of the surgery with these IOLs can go up to 1 lakh, whereas their Indian counterparts will cost you around 60 to 70k. Furthermore, in cases of bilateral cataract surgery, it is possible to combine different types of IOLs to improve binocular visual outcomes at different distances. This approach is called mix and match or blended vision and provides promising results, especially in combination with EDOF IOLs. So for example, we put a trifocal implant in one eye. That means the patient is able to see clearly at all distances but with minor loss of contrast sensitivity. For the other eye of the same patient, we plan an EDOF lens to give him superior quality of vision and enhanced contrast sensitivity. Now when the patient focuses on any object with both his eyes, he is able to see clearly at all distances with good contrast and a good quality vision, thereby providing the patient with a near perfect vision. So this was all about the premium lenses, their pros and cons and their approximate budget you would need to get them. However, even with careful planning, patient can end up dissatisfied. The most common cause of dissatisfaction in patient with multifocal implant is the residual refractive error, followed by dry eyes, glare and halos. So even with utmost care in calculating the power of IOL, refractive surprises does occur, which can lead you to wear spectacles for fine work. A patient needs to understand that surgery can occasionally go unpredicted and the doctor needs to opt for safety over priority in choosing the lenses. The ideal patient is motivated to achieve spectacle independence for distance and near vision, understands the limitation of premium IOL and has realistic expectations. Lastly, there are certain patients who are not good candidates for opting the premium IOLs. For these patients, the result may not be as good. These are patients with very high visual demands, any pre-existing corneal pathology, advanced dry eye, retinal pathology like diabetic retinopathy or macular degeneration, post-refractive surgery patients, complicated cataract, glaucoma and amblyopic patient. I hope this video was informative to you. If you have any queries or you want to share your experiences, to write to us in the comment section below or call us on our helpline number 9711115191. We'll be happy to assist you in choosing your perfect IOL. If you like this video, do hit the like button below. Also do subscribe to our channel for more such updates on eyes. We are happy to discuss standard versus premium IOLs with our patients so they can determine which is more beneficial for their unique situation. Thank you. Have a good day.